All right, welcome back, everyone. I hope you had a lovely 5 minutes, maybe got a snack. And so let's jump right back into it. So now we have Miss Erin McHugh and Miss Catherine Maruto, both our student presenters. Just Miss Erin?
No, it should be Dr. Jones.
Oh, yes, Dr. Jones. Sorry. I apologize. But yes, first we have Dr. Jones. She's our final distinguished guest speaker. She's a professor and chair of the Department of Environmental Health Sciences at UCLA, and she'll be talking about the roles of power and work equity. Take it away, Dr. Jones.
Great, thank you very much. Yeah, so I'm at UCLA. I've been here just for a couple of months, and I'm going to talk a little bit about this issue of power and work equity, which really I've been thinking about for the last year and a half. Before I came to UCLA, I was at the University of Utah, and I was the initial center director for the Utah Center for Promotion of Work Equity Research. Since I've left, the center has been taken over by my good friend and colleague, Dr. Emily Ahonen, who works on more of the social science side of occupational health, and my associate director, Dr. Kami Schaefer. And this is a NIOSH Center for Excellence in Total Worker Health. Total worker health, as I'll mention a little bit more, is a concept that's become quite prominent in the occupational health world in the United States, and is really trying to move beyond the idea that it's sufficient that a workplace be free of hazards to health and safety, and actually be a place that can help to support the well-being and quality of life and health of workers. So our center is a little bit different than the other centers in that we really are focused on trying to create better work for everybody, and we consider the lens of power as part of this. So the center envisions work and workplaces that are safe, healthy, and equitable. Together, we can ensure that conditions of work promote the health and well-being of workers and communities. So work equity versus equality. Now, the difference between equity and equality is not specific to work, but we can use this example here where in equality, workers are all treated the same, and but you don't always get the same outcomes in terms of health and safety. And we know this because we see significant disparities among workers. For example, workers in the construction industry who are of Latinx heritage, who are foreign-born, experience higher rates of injury and fatalities than workers of the same heritage who are born in the United States. Clearly, that's something where they may be treated the same at work, but they are experiencing different risks and different health outcomes. Equity then is specific, that considers that the specific needs of workers are accounted for in the allocation of resources and opportunities so that workers experience equal outcomes. So in a workplace, you can facilitate equity, but you can also consider how access to work and the quality of work results from social, political, and other resources, and how those are distributed by society at large that makes it possible for workers to have access to safe, healthy work. So for example, if education is not equally, if not everybody has the same types of education, then they don't have the same access to good quality work. I found this illustration online from the George Washington University School of Public Health. And I think that it illustrates nicely this kind of question where you have unequal conditions, and so only some people have access to the fruit. So equality says, okay, we'll give you better access to the fruit by giving you the same ladder, except in this case, you can't actually reach the fruit. And if you think about this in work, maybe these apples or the fruits are wages, right? Where you get the same ladder, but you don't get the same productivity, or you don't get the same wage. So in equity, we would give the people who need it a larger ladder so that they can access this benefit or have the same benefit, but at the same time, they are working harder. They have to climb up a taller ladder to get there. And so then we can even think about justice, right? Where providing them the same ladder, but changing the conditions of the work it enables people to have the same type of experience and outcome. So what is power? I mean, fundamentally, we know that power is the ability to make things that you want happen. But really, it is the product of a set of relationships between and among people that also considers historical context and social structures, right? So for example, as a professor, I have education, I am white, those things give me a historical and social context that give me more power than other people who might not have those same characteristics. We can think about power, though, in different ways, too. Power is exerted in different ways. So you can have power over some people. You can have power that you use with others to make what your group wants to happen. And you can use power to do things to other people. And you can use power kind of within yourself to, or within a group to make actions. I'm sorry, I'm kind of monitoring another webinar that my students are doing, so it's just ending. But power also comes from structures in society, right, that give power over others. So one example of this might be regulatory structures where one group, the government and institutes, gives rights to certain people over others, or tells some people that they can or cannot do things, or an employer has power over employees because of the relationship between those individuals, and the structure of employment gives employers power. Power is a dynamic event, right? That occurs between individual workers or groups of workers and employers, but it's also influences this kind of broader social force that shapes how society imagines work, right? I would say that society at this point in time, right, we can imagine and we can accept narratives about work, that work is something one has to do, that work doesn't have to be pleasant, that it's okay that you experience harm at work, right? We have quite a high social tolerance for experiencing injury and illness at the workplace, because we observe that these things continue to happen. And while we do make progress, we tolerate that they persist, right? We have a great tolerance for bullying in the workplace, harassment in the workplace. We have a tolerance for women and men to be treated in different ways in the workplace, to experience different wages. We have a tolerance for people to be divided into work and to racialize work, so that there are certain types of work that are performed by certain individuals who are predominantly from specific racial groups or from specific gender groups, right? So these are all the ways that we can think about society and how we have defined a concept of work that is not necessarily safe, healthy, or promotes our well-being, right? But when you're at work, there are different factors that as this figure illustrates, influence kind of who can have power, right? So we, for example, have systems of sexism where we can look at the relationship between men and women and how that influences pay, roles, and responsibilities at work. I was recently, or a year or so ago, I was at the British Occupational Hygiene Society, for example, and there was a group of women and trans women speaking about their experience in the workplace. And they all said, and these are women who've achieved great things in their careers, and they all said, oh, yeah, there's no problems. But as a woman, I have to be more prepared. As a woman, I have to work harder. As a woman, I have to tolerate going into a mine and seeing pornography everywhere, right? Now, I don't think men necessarily want to see pornography everywhere either. Or the worst, I always have to get the tea, right? And so those are systems of sexism or examples of sexism that impact how a person is able to fulfill their job, right? And some of these things one can overcome through hard work, and some things like wage discrimination, for example, are more difficult to overcome as individuals. And so similar, we have systems of racism. We have economic power. So people, for example, who have more money have more control and discretion and power over defining when and where they want to work. Normative power from social norms that that let certain individuals and groups have more influence over others. There's legal power that defines working conditions, minimum wages, benefits that workers can receive, right? Political power, how you can persuade others to take actions that can influence this. And then there are a variety of other systems. So work is not conducted in isolation. It is influenced by these larger social, political, and economic forces. And all of these reflect differences in powers. So my colleague Emily Ahonen and her collaborators recently wrote a paper about employment quality. And I'm just showing you this because I think it illustrates this concept well. So if employment quality is a very generic idea related to the idea that work can be better or worse in a global sense, right? You have this tension, it's a dynamic between workers and their employer, right? Each of them have power, right? Workers, for example, have the power to withhold their work, or whether that is because they work more slowly to decrease their productivity, they withhold their work by not going to work, right? We have some of these actions going on now. They can organize their work so that it's not individuals taking these risks, but entire groups of people. And employers have power too, right? They have the power to hire and fire people. They have some power to set wages. They have power to set benefits. They have power, well, both groups maybe have power to persuade the media that their cause is more important than the other side's cause, right? And Emily and her colleague would argue that these power balances, at least in contemporary America, are not equal forces. Right? And that's why we have this slope, right? Where the employers tend to have more money, political connections, access to legal resources, and thus they have a greater influence on social political factors and labor market contexts than workers have political powers, right? So in the United States, for example, we've seen a great decline in unionization, and unionization being one of the main mechanisms by which workers are able to exert power. And that means that the unions don't have as much influence with legislators. And so they have less influence over market conditions and social political factors. And so we can see in this illustration that there's this tension between the two groups. And there are different ways that we can try to shift that power back and forth, right? By using political power, using media, using grassroots organizing, using labor unions, maybe to try to improve the power of workers. And right now, you know, we have sectors in the United States where we can see this kind of power coming to fruition, in that there's a major movement that's put new legislation on the ballots in many states to increase minimum wages significantly. In California, we just passed a law recently, or the legislator just passed a law recently, to set a new minimum wage for workers in the fast food industry, as well as to create a panel that will help to evaluate and establish different types of labor conditions and health and safety training expectations. California is a unique state, though. I mean, it's a very pro-union state. The legislature the government supports unionization. Most recently, I lived in Utah, which is very much an anti-labor state. There's very low unionization there. Even the Utah OSHA, gets in trouble for not enforcing the laws, and that's their sole purpose for existence. So, these things vary depending upon the social and political climates, right? So you see geographic variation, you see variation over time, and you even see variation over the theme that's actually relevant, right? Like today, it's pretty easy to make the case that minimum wages in the United States are inadequate. And so you can get more traction there than you might get trying to argue for paid paternity leave, right, for example. So these issues are very complicated, but I think power offers a lens through which to understand who is doing what and why, right? Because it explores who is benefiting, who gets to make the decisions, and what is it that different parties have to gain from that. So I want to tie this back to sustainability issues, right? And I think we could all agree that one of the goals is decent work for everybody. And the International Labor Organization describes decent work as opportunities for work that is productive and delivers a fair income. Okay, so I guess to me that means that in your work, you are working, you're doing something, and you are receiving a fair and appropriate compensation. Provides security in the workplace and social protection for workers and their families. You have prospects for personal development and encourages social integration, gives people freedom to express their concerns, to organize, participate in decisions that affect their lives, guarantees equal opportunities and equal treatment for all. And these are really wonderful goals. And I think we're very far from this. That may be a severe understatement, right? I think we can all look at our own work and say, like, okay, I think my work is productive and for me delivers a fair income. I have a lot of security and social protection because of my job. You know, personal development and social integration. I mean, I don't know, that's a great job if you can get it, right? Freedom to express concerns. Again, these are kind of things that go to this idea that work is not just about being safe and healthy, but it enhances your well-being and perhaps even allows you to flourish as an individual. So in the United States, we don't often talk about decent work. There has been a move in the American Public Health Association's occupational health group to define decent work as a goal, but more accepted is this concept, at least in the occupational health community, of total worker health. And so this is an idea that originated with the National Institute for Occupational Safety and Health. And really the goal of this is to move beyond having workplaces that are free from hazards to one that also enhances well-being. And so here they're thinking about programs and policies and regulations. And this is the graphic that that organization presents about the concepts that are related to total worker health. And it's like everything. Right? We've got infectious agents down here and biological agents. We have protection from wage theft. We have accommodations for people with disability. Supportive managers. Oh my goodness. Right? It's like everything that one could imagine could impact work. And if you think about this, as an occupational health professional, most of these domains are really beyond my scope of influence, right? I'm an industrial hygienist. I'm down here in this corner. Maybe I get over here to sensors and robotics. I think a little bit about the built environment, but I really don't have professional expertise or rules in organizations as an occupational health professional that sets compensation and benefits, for example. And so I feel like as an occupational health person, we struggle to understand what it is that we're able to make happen here. But you can see how these things result from a variety of social, political, and economic factors that extend beyond the employer and employee relationship, right? So compensation and benefits, yes, are set by an employer, but they're also often governed by regulations, social norms, and economic kind of market competition, right? Same thing with various policies. Yes, an employer may set policies to eliminate harassment, but there could also be, for example, there is in England regulations that would prevent harassment in the workplace. Family and medical leave, again, is a policy that's set in the US, a minimum standard by the federal government. And this is very much influenced by attitudes and expectations of family structure, for example, that only women should have leave after pregnancy, not men, right? That has slowly come to fruition in many companies, but is not necessarily national policy. So again, this illustrates how power extends well beyond the employer-employment relationship. When we look at the development goals, work is only specifically mentioned in number 8, but most, if not all of these impact work or are impacted by work. Certainly having decent work that pays a wage that's reasonable goes towards poverty, hunger, right? Having work that allows for being a workplace free of harms, right? Where you're not experiencing injury, illness, and maybe you even have the ability to flourish, impacts good health and well-being. Education certainly helps to give you access to better quality work. Gender equality would help to address disparities related to gender. Clean water and sanitation. I mean, we have workplaces in the US where people still do not have access to bathrooms and hand washing facilities, right? And so, you know, affordable clean energy creates different types of jobs, some of which could be better or worse for the health and safety of workers, right? And so you can kind of go through all of these and find ways that they are related to work. And so I just encourage us to think more broadly about work being a phenomenon that extends beyond the confines of your workplace, your office, or your factory, or wherever it is that you happen to work, because it has such broad implications and is so influenced by the attitudes, laws, and regulations that exist in each country. So to kind of circle back to the work equity concept, achievement of work equity represents progress on many fronts that is related to both workers themselves, the communities, and sustainable development for industry, the environment, and all of these other factors that influence the type of jobs that are available, the conditions in those jobs, and the ability of workers from all to have equal access to good quality jobs. And I would argue that by thinking about power, we can help identify root causes and potentially universal interventions that can improve conditions for all workers and have impacts that extend beyond the workplace, because every worker is part of a family and is part of a community. And by enhancing their work life and their occupational health, we can benefit their family and their community. And when we think about power, my colleague, Dr. Schaefer, thinks about this as kind of three phases: organizing people and money, political infrastructure building, narrative, worldview, and ideology, right? We're organizing people and money as you know, could be, for example, unionizing. Political infrastructure building would be, you know, electing officials who favor this and passing regulations and other types of laws that create a structure that helps to enhance the quality of work. And narrative, worldview, and ideology, helping us to redefine social norms so that we can make work decent for everybody. So I'll stop there. And if you want to learn more about the U Power Center, please see their website. And actually, we have a really, I must say myself, I did not create it, but there's a really wonderful social media campaign that highlights not only current issues related to work equity, but also how work is represented in film and fiction. And so every week on the social media, we highlight movies and books on this topic as well. So if you are ever looking for a movie suggestion to learn more about how work is represented in popular culture, I think it can be very insightful. So thank you.
Thank you.
Yeah, thank you, Dr. Jones. That was an amazing presentation.
Thanks.
Are there any questions for Dr. Jones?
Nick, did you have a question?
Me?
Yeah, I thought you raised your hand.
I just wanted to highlight, I think that this is incredibly important work. So thank you, Dr. Jones. And especially I think for the students to hear, and look forward to checking out that social media page as well.
Yes, we're on Facebook and LinkedIn, I think. My assistant was explaining TikTok to me yesterday, so I'm not sure if we're on TikTok, but
Me neither.
It's coming.
Rachel, do you have a question? Thought you were.
No, I was just clapping because it was a good presentation.
Oh, thanks.
Dr. John, like, wow, NIOSH is changing.
Yes,
Like,
yes.
kind of you and I were kind of old school type, and we study exposure, chemical exposure, biological exposure, physical exposure. How do we control hazard? That's I gave a presentation to your program before, but wow, they talk about total health, total workout health. That's
Yeah.
amazing.
Yeah, so it is interesting because they're still trying to understand exactly how to operationalize that, both like as a concept for professional practice, because the domains really extend beyond the expertise and influence, the day-to-day influence that occupational health professionals have in their jobs. And then the question is, what is research on this topic? And I actually was just at the third International Total Worker Health Symposium a couple of weeks ago. And I will just say that I think the question is still out there. What is research about total worker health? I think what most people who are doing research, like through the centers of excellence in total worker health, is that there's quite a bit of kind of community-based or worker participatory research trying to identify interventions that can improve things beyond just injury and illness rates, right? So that they're looking at interventions that might have broader impacts on work quality. So injury and illness rate reduction would be one metric, but other metrics might be access to better foods or changes in employer policies, right? So some of the research targets workers, like organizing workers or working closely with them, and others kind of are interventions targeted at employers to try to make employers change work conditions for their employees. And those can range from like more traditional health promotion activities like better food at the work site or smoking cessation programs to other kinds of wellness related initiatives and other kind of changes in employment conditions. So I would say that this area in the US research community and in the NIOSH thinking, it's great expansion, but I would say there's still a lot of big question marks about what it means in practice.
Keep me in touch. No.
But it is very exciting for those of us who were trained to just measure a chemical and say it was okay or not. It's really exciting to think about how we can make other types of changes.
I just wanted to also echo a lot of the comments in the chat and what was being discussed. As someone who comes more from the social sciences and has looked a lot into sort of like feminist ethics, I was not expecting a presentation around sort of work and occupational health to focus on like power structures. And so it was just amazing. I was like, wait, my ears just perked up. And I'm just really grateful for you and folks like you who are doing this work. My grandmother, who got her MPH back in the early 50s, was doing like a lot of work around farm worker health, and she was coming much more from the like chemical and pesticide exposure side, but a lot of it was about justice for farm workers as well. So it's great to kind of see this coming a little more full circle and really focusing more on that. So
Yeah.
thank you for the presentation.
Thanks, Heidi. And I mean, I'll be perfectly honest, like this is all very new to me, and I rely heavily on my other collaborators who have much more grounding in the kind of theoretical constructs and frameworks that we're using in this. And I am piggybacking very much on it, but I do find it really exciting because as an academic, we struggle to find ways to get people to care about this topic and want to pursue it, right, as a career and want to work in this domain. And I feel like this kind of thematic area is very exciting for people who don't come to it necessarily, I mean, traditionally people come to occupational health because they were an engineer or something like that. And I think that our field has changed so much over the past 15 to 20 years and become so interdisciplinary that we now have much more room to welcome people who come from different types of backgrounds, including, you know, training in the humanities and social sciences, and bring, you know, those kinds of perspectives to our problems.
Thanks again.
Nick?
Yeah, I'm gonna circle back with, can you guys hear me?
Yep.
With another question. I'm thinking a little bit just about kind of big tech getting into it, thinking about Apple Watches, and some of the stuff maybe is becoming maybe more measurable. We can apply some of that data to that research. Just your kind of thoughts on that. I'm thinking of just going to work and the things that we can measure now, but I'm certain that's going to continue to evolve. And we can probably see, you know, how that develops. So just your thoughts on that.
Yeah, I mean, I think sensor technology of different kinds, and even kind of logging of behavior, you know, logging of things that one can have access to now with the technologies. And there's like been a lot of research, I know, with like youth smoking, where they do like, they send text messages to ask like, you know, are you thinking about smoking? And, you know, getting kind of real-time data, right? So you can imagine, you can ask workers like, what's happening at different times over the course of their days using these technologies, or monitoring activities. And, you know, I think there's still a number of questions around kind of privacy issues, because once you start doing that kind of sensor monitoring in workplaces, you're getting very, very granular information about what the employee, where they are, what exactly they're doing, what they're, you know, what they're thinking, what's happening. And there can be some resistance to that. And, you know, like in the safety world, there's been a lot of innovation in that area, but it's coupled by these privacy concerns. So you know, for example, if you work in a mine and you drive one of those giant trucks, there's a camera in the cab that is looking at your eyes. And if your eyelids close, it sends off an alarm and your seat vibrates. And, you know, I mean, to imagine that somebody's watching your eyelids all day, every day, is spooky. But for them, it has a very practical safety application, in that you don't want one of these giant trucks filled with giant rocks to have a car, you know, to crash, right? Because then people die. And so, you know, I think there's these kinds of trade-offs about the questions that we want to ask, and the monitoring function, and the type of data collection. So, for example, in some focus groups, workers are fine with having their locations monitored, but they don't want to be videoed. You know, but it depends on the setting and the purpose of the data. And I think there's a big debate about, you know, it's also better if the workers are engaged in the decisions to do the kind of sensor assessments, and then have trust with their employers.
It's exciting, yeah, to kind of be at the forefront of
is.
some of that's happening. Thank you.
It is exciting.
All right, any last questions? All right, well, thank you again, Dr. Jones, and thank you for all the questions, everyone.
Thank you.
Yes, of course. All right. So now we have one of our last presentations with Miss Erin McHugh and Miss Catherine Marudo. They're both student presenters. They are MD and PhD students in the School of Medicine at the University of Miami, and their presentation is on patient perceptions of postpartum readiness, a survey study. So take it away.
Hi, everyone. I'm trying to share my screen right now. I'm having a little bit of difficulties. Give me 1 second. Kathy, do you want to try sharing?
Yes, I can try. Give me a moment. I wonder. Can everybody see my screen?
Yes, it's up now. Thank you, Kathy.
Yes.
So, hi, everyone. I'm Erin, and I'm going to be presenting with my friend and classmate, Kathy. We are both studying medicine and public health at the University of Miami, and we're going to present some of our research that we've been doing about patient readiness for the postpartum period. We think this is an important research topic because access to quality reproductive health care and health education is a priority set forth in the SDGs, and the postpartum period is really important to parental and infant health and well-being, both physical and mental health and well-being. So we wanted to better understand factors that help new parents feel ready for this period. This is just a brief outline of what we'll be presenting. You can keep going. And the current research on this topic, there is a good amount, but a lot of it is based off whether a provider, so a nurse or a doctor, thinks that a new parent is ready for the postpartum period. And there's actually not a lot of data about how the new parent feels themselves. So we thought it was important to try to take a patient-centered approach and understand directly from the source what makes new parents feel ready or not ready for this really important period. And we also thought it would be interesting to look at a population where a lot of people aren't necessarily English speakers or who are minorities, and Miami is a really great area to study a population like this.
So the objective and hypothesis of our study was multiparous patients feel more prepared for the postpartum period compared to parous patients. And this is operating on kind of a lot of assumptions. Basically that those who have gone through the birth process before likely maybe have greater experience with the process and then therefore feel more prepared. But we felt that it was really necessary to understand what challenges multiparous patients still felt undergoing pregnancy again for the second time, and what challenges may be similar or different to those who are first-time parents kind of going through this process. So that was kind of the objective of our study again.
So the way that we did this study is we distributed anonymous surveys to 50 patients who were coming for their follow-up postpartum appointments after having given birth within the past 6 weeks. And we used a modified version of a survey called the Perceived Readiness for Discharge After Birth Survey. And the data was analyzed using simple and multivariate regression models to assess for factors that were significantly associated with perceived readiness for postpartum. And something that's unique about this study is that since we surveyed the new parents after 6 weeks, they were able to identify after they had gone through a significant chunk of the postpartum period, whether they were ready or not, whereas a lot of previous research surveyed new parents while they were at the hospital right after having given birth and said, do you think you're ready for this period that you're about to go through, but not necessarily afterwards, when maybe some of their thoughts might have changed after really experiencing what it's like to be postpartum.
So just a little bit of background on our survey design. So like Erin had mentioned, the survey was completely anonymous. We used a modified version of the Perceived Readiness for Discharge After Birth scale, which is a validated study. We modified some of the questions a little bit, but this study has been used in several different research, validating its effectiveness at eliciting some of the questions and responses that you see there on the right side of your screen. We used yes and no questions for our patients, and we also used REDCap as the primary data bank to house all of our surveys. And we defined readiness for postpartum as our participants answering 80% or more to any of the questions. So if they answered 80% or more to any of the questions that you see there on the right, then they would qualify as ready versus not ready. So some of the questions that we asked was like, are you physically ready to go home? We asked them if like they had any discomfort. We also asked them a modified question was whether or not they felt like they had the necessary information that they had in the prenatal period to kind of feel confident moving forward. We also asked about their home life and assessed like what kind of help that they had at home. Kind of looking at, again, like Erin had mentioned, a more patient-centered approach and seeing what resources that they had and wish that they had in the postpartum period as well. So this was sorry, go ahead, Erin.
To whether or not the new parents felt ready, we also looked at things like whether they were breastfeeding or bottle feeding or had a vaginal delivery or cesarean to try to assess if factors like those impacted how ready they felt and if there were differences between the groups.
Yeah, so again, this slide kind of gives you a snapshot of the questions that we had in our surveys. We also assessed if they attended any prenatal classes, if they were, again, physically ready for postpartum, if they were emotionally ready. And we also wanted to understand if they themselves were not just taking care of their newborn, but also if they felt physically ready to take care of themselves, because we felt that was really important to elicit from these new parents. And some of the things that we also asked were if they knew about the problems to watch out for when they went home, if they were even able to cope with these problems, how they emotionally felt going through these problems. And we kind of like gave them an opportunity in question 11 to give us an opportunity to know if they felt supported by their practitioners at the hospital, like if they felt like people told them what to expect or their providers told them what to expect in the postpartum period. And yeah, so it elicits some of the support that they had, some of the support that they didn't have, and then internally some of their perceived self-advocacy for themselves and the resources that they felt that they had during the postpartum period. So some of the results of our survey in terms of demographics, 74% of the participants that we surveyed identified as white, 24% identified as Black and African American, and 1% identified as Asian. 56% of our participants also identified as Hispanic. Again, we surveyed primarily participants in our Miami clinics, and 46 were primiparous and 54% were multiparous patients.
So like I said before, we did look at factors like whether mothers were breastfeeding and bottle feeding, whether they had private insurance or public insurance sort of as a conduit for socioeconomic status. We looked at age, education level, and interestingly, none of these were significantly associated with feeling ready or not ready. So the only thing that was significant was being primiparous as having your very first birth or multiparous as having past birth. So then we adjusted for all of these again in the analysis to make sure none of these were confounding the results for primiparous versus multiparous parents, and they were not. So that was the significant result of the study.
Yeah, the significant result, like Erin had mentioned, that we found was that using the logistical regression model, accounting for all the variables that Erin discussed in the previous slide, the logistical regression model showed that multiparous patients were significantly more likely to feel ready for the postpartum period compared to primiparous patients. And again, this was their self-perceived readiness. And something that was also really interesting was we found that roughly 60% of primiparous women had like their mothers helping them during the postpartum period in terms of taking care of their newborn. And then that number drops down to 40% for multiparous women. So you see that multiparous women are 20% on average less likely to use like support like their parents to help them with their newborn. So that might also be kind of a metric to see that multiparous patients feel a little bit more comfortable with the process than do primiparous women or patients.
What we take away from this is that providers, doctors, nurses, healthcare professionals should provide comprehensive postpartum resources to all patients, but really focusing on first-time parents, and that healthcare systems should try to add in more time in prenatal appointments for patient education and questions. And we thought it was really important that providers be mindful of assumptions that they may have held about whether somebody's education status makes them more or less ready to go through the postpartum period, or whether their financial status influences that. And instead, they should make sure to give the same level of education to all patients and make sure it's very equitable in how we're preparing first-time mothers and multiparous mothers for the postpartum period.
Yeah, and Erin and I were also discussing that oftentimes when we've observed like the clinics, we find that like the appointments are pretty scheduled roughly the same. Same questions are asked, and even though some people may be first-time mothers or second-time parents or first-time parents, we don't really see a lot of differences with how the patients are treated, and whether that's a good or bad thing is like up for debate. But sometimes, like we had mentioned in one of our points here, there may be a need, at least in our patient population in Miami, to focus some of the time and energy to seeing how supported primiparous patients feel. And that kind of goes with some of the limitations of our study. So we did have a small sample size, and the results that the sample size that we did take was from our Miami population here, and very specifically to our healthcare system here at the University of Miami and at Jackson. So the data that we have may not be generalizable to primiparous versus multiparous patients as a whole, but I think this is a good opportunity for other institutions and other healthcare institutions to understand their populations and their what the populations at their health care centers feed at the needs of their patients, because what our patients here in Miami may need may be different from different parts of the country. So I think that's a limitation that we have in our study, but opportunities for growth in this area of research. Our savers were also anonymous, so it's hard for us to follow these patients and understand what their kind of postpartum picture looks like now beyond the 6 weeks. And we also collected the data in a rather short time frame. We could have kind of widened our net and collected data longer. And like I had mentioned, there's some geographic limitation in terms of generalizability of our data.
In the future, we hope to see similar studies done at different institutions just to see if there are any differences between populations. And we also think it'd be really interesting to do focus groups to perhaps get a more qualitative idea of what it's like to go through the postpartum period. And we also think that there needs to be improvement in current practices. So greater emphasis on patient education, building in perhaps a little bit more time for first-time parents, and providing better resources. And Kathy and I are actually working on updating some of the pamphlets that are given out, the educational pamphlets at the hospital, to try to make them more inclusive of resources and just more comprehensive for parents.
Yeah, looking at the pamphlets that are given out to our patients here at Jackson, a lot of them focus on like birth support classes and how to sign up for those classes, but there's not actual physical informational pamphlets within the folder that actually give these birthing people and resources on like how to properly breastfeed. It's like, attend this Zoom link, and we acknowledge that sometimes these patients may not have access to technology or Zoom, or even have the means to attending a scheduled Zoom meeting on breastfeeding. So really making resources that patients can take on their own time and use for whenever they need it is really important. So we're working with the physicians at Jackson here to provide that for patients moving forward. These are references. Thank you for everyone's time.
Thank you guys for a wonderful presentation. Very informative. So yeah, are there any questions or anything?
I have a question. Many of you may have seen my little tiny baby throughout the presentation. Now is with another caregiver who arrived home, but yeah, as someone who's in the postpartum period, well, I guess just out of it, really appreciate this work. This is so important. And I'm curious, you may not have had enough power with your sample size, but I'm curious if you were able to do any analysis on any of the specific items of readiness, and if rather than just as a whole scale, and if there were any particular areas that stood out in your study for where birthing people were more or less ready kind of across your scale, or if that any certain areas were more affected by, you know, first time versus multi-parous women as well.
That's a really good question. We actually didn't look at the specific individual questions about readiness, and instead we just lumped them together as if you answer yes X amount of times, you're ready, and if you say no, then you're not ready. But it would be very interesting to see if there were differences between the individual questions. That's a good point.
I will say when I was on the grounds actually distributing their surveys, a lot of patients were very vocal when they were taking the surveys about just like how they felt like when they were answering the questions. I remember a patient told me like, oh, like I wish my provider told me that breastfeeding might like actually be this painful, because like it was really tough for me to continue because no one had told me that this is what I would experience. And I think to improve the survey, something that we could have added or focus more on was like giving more like free response texts to patients so they could really like describe their experiences in that way versus limiting them to the few questions that we asked and like keeping them in the binary yes and no. And I think that's why Erin and I mentioned like maybe having focus groups where we really can talk with these patients a little bit more and guide our approaches to resources with what they need versus what we assume they need, really like guiding those resources and tailoring it to what they tell us that they need. I think is important to move forward. So I wish that that's kind of what we were, I wish that was something we elicited more in our surveys.
Thank you for that. I also really appreciated that one of your recommendations was to have like concrete information instead of just how people can find the information. Because I know that's something that once particularly you're in the postpartum period is really difficult to do. So if you haven't already taken the classes, if you haven't already gathered the information, it's hard to then seek it out. So it's nice to maybe have something where it's already written down rather than take this class or go here to find more info. So yeah, thanks again.
Thank you. Ms. Hollenbeck, I think you had a question.
Hi, I do. I am really curious. I had I did my PhD work in looking at access equity to nature spaces, and found something very interesting that you both showed in your study. Were you surprised that experience overcame those demographics that you shared, or was that expected to you?
I was shocked personally, especially because in Miami, there is a lot of disparity in socioeconomic status and education, and seeing that, at least in our small sample size, that hadn't had an impact on whether people felt ready or not was shocking to me. I thought that would, like, especially like private insurance versus Medicare as a conduit for income, I thought that would definitely have a significant impact on how ready people felt, but when it came back that it didn't, I was shocked.
Yeah, similarly, like, oh, sorry. No, yeah, similarly, I think when me and Erin were going through the data, I felt the same way. And I think that made us like reflect on it a little bit. And we kind of thought about it. And I mean, a way to maybe explain why we didn't find that as like significant was at the end of the day, like that is also us kind of like buying into those heuristics and biases and assuming that one population is going to struggle more than the other versus basically like just the experience overall of parenthood and getting ready for the postpartum period. I think it was humbling to see that perhaps like we shouldn't necessarily focus so much on race. I mean, it's very important, or like economics, but I think that might be a shortcut that we take oftentimes where we fail to look at the big picture and just see that becoming a parent may be a universal experience that's difficult for almost everyone. And we shouldn't assume that maybe somebody of higher economic status will find it any easier. Obviously, they may be well-resourced to better support themselves through the process. But at the end of the day, if you're asking someone like, was this difficult for you? It's very valid for them to even say like, yes, even if they were of higher like SES. So I think that was also important for us to reflect on. And I valued that our data showed that too.
Yeah, and something that was really interesting was one of the doctors that we work with, she was actually just coming off of the postpartum period, and she's an OB-GYN, and she said she felt so incredibly not ready for the postpartum period. So it was just so eye-opening to see that somebody who spent their career studying pregnancy and childbirth and sexual health could say that she herself felt so unprepared. It was surprising, but it shows a lot about the state of our system.
Thank you both.
Thank you.
Rachel?
Oh yeah, I just had a quick question. You guys said in your methods you chose like an 80% result for readiness. Was that used in a previous study, or how did you come up with like that 80%?
I think that was based off of what they used in the original study that we took the survey from, the perceived readiness for postpartum survey or for birth survey. Yeah, but theirs was on a scale, so it was a little bit different than ours. Theirs was more of a numerical, it was like a sliding scale, but we just based ours yes or no and did 80% of the questions.
Okay, awesome. Makes sense.
Nick, I think.
Hi, yeah, guys, great presentation. I learned a lot. And I think it's awesome that you guys are thinking about the future work. You had mentioned that you were thinking about perhaps folding in some qualitative data. I think that would kind of produce some interesting results, and I think it's a really good idea. So thank you, guys.
Thank you for that feedback.
All right. Anybody else have any questions for them? Last call. All right. Well, thank you to all of our presenters, all the presentations, and all the information that you presented was very informative, absolutely fantastic. And a lot of you also happened to raise awareness about topics that I feel like could use extra awareness. So sincerely, thank you. So now to wrap up the presentation, I would like to welcome Dr. Julie Hollenbeck, the President of the Board of Directors for the Global Environmental Health Lab, to close out our symposium today.
This was fantastic. I am so glad I was able to attend. So thank you, everyone. Yes, I am Julie Hollenbeck. I have been the president of the Global Environmental Health Lab Board of Directors for, I think, about 3 years, and then treasurer before that. And it's just been an absolute honor to work with Dr. Shibata and soon to be Dr. Heidi West and the professionals and students that participate in the lab's global projects and initiatives. Just a brief sentence on my background. I currently work in public health, and I work to build innovative partnerships across our healthcare and public health system, K through 12, governments, emergency response, you name it, just to promote the health and well-being for all in a more holistic manner. And so my closing remarks are with that frame. So first, thank you all to the presenters for informative and really thought-provoking presentations. They were fantastic. And I want to say thanks to those that attended and those that might be watching later on video for all the work you're doing every day to promote sustainable development and achieve peaceful, inclusive, and just societies, because in the end, that's the goal. Each of these presentations today and the amazing work behind them and what's left to come show the importance of partnership, equity, action, education, research, of course, lived experience, and community in achieving sustainable development. It really does take a village. There are 7 years remaining to achieve the Sustainable Development Goals, but as you all know and showed in your presentations, we are facing so many challenges locally and internationally. And it's critical for governments, NGOs like this one, industries, community leaders, health and public health professionals, and academics to seek each other out and work together to share knowledge and best practices, really beyond that conventional dissemination of research that is often siloed with specific audiences such as academic presentations and journal articles and such. And so as we draw the 7th International Symposium of Sustainable Development to a close, I really encourage you to visit the Global Environmental Lab's website, connect with leadership, the board, us, please ping me anytime. I do a lot of mentoring and I know many of our board members do too. And connect with the students if you can. Subscribe to the newsletter, share and promote the great work we're doing within your networks. You can even mentor a student or encourage people in your network to mentor a student and support the lab's efforts with a monetary donation or sustaining donations. We really need to work together to promote and support safe and healthy environments and global health on a local, regional, and a global scale. And
Maybe, we have recorded 3 hours of presentation, they may be overwhelmed. I don't know, just give a second. But I think you got the message from Dr. Julie. Julie, you're back. Yes.
yes,
Go ahead.
I should have taken my video off. I was tempted to do that. And so did you hear any of that? If you didn't, I just want to say you're wonderful. Go forth and bring health and well-being to all.
Thank you, everyone. And then, I hope see you soon again in face-to-face, and then, see you in the US and see you in another country. So thank you for joining our symposium, and have a good night. And those students and the professor who attended from Indonesia and Myanmar and the other country, thank you for waking up so early, and I will see you guys in the future. Thank you very much.